How does oral motor imitation help CAS? Imagine a child trying to say a word but struggling to get the mouth movements right. That's often what children with childhood apraxia of speech experience. Now, let's explore how copying speech movements can make a real difference. Oral motor imitation is a technique used in speech therapy where children watch and copy the movements of the speech therapist. This helps children learn the specific muscle movements needed to produce speech sounds correctly. Since childhood apraxia of speech is a motor speech disorder, the main issue is planning and organizing the precise movements for speech. Imitation helps them practice these movements directly. When a child imitates speech movements, they get a clear example of how their mouth, tongue, and lips should move. This combines what they see, hear, and sometimes feel, making it a multisensory experience. This approach helps children understand the connection between the movement and the sound they want to produce. It's like giving their brain a map of the correct motor pattern. Repeating these movements through imitation builds the child's motor skills step by step. It encourages them to practice the exact gestures needed for speech, which is essential because children with childhood apraxia of speech often have trouble planning these movements on their own. The more they imitate, the better their brain becomes at organizing these movements quickly and accurately. Speech therapy methods like the integral stimulation approach and dynamic temporal and tactile cueing use imitation as a core part of teaching. These methods follow the watch me, listen to me, do what I do sequence. This helps children link what they see and hear with how they move their mouth. It's especially helpful because children with childhood apraxia of speech often find it hard to plan speech movements without visual and auditory cues. It's important to note that imitation is different from non-speech oral motor exercises like blowing or tongue wagging. Research shows that practicing speech movements through imitation is more effective for improving speech than non-speech activities. Imitation provides a direct model of speech, which helps children learn the actual movements they need. In therapy, oral motor imitation is used to break down complex speech into smaller parts. For example, a child might first imitate a single sound, then a syllable, then a word. Repeating these in a structured way helps reinforce the motor patterns. Therapists give specific feedback to guide the child and increase the number of practice trials, which boosts learning. Overall, oral motor imitation helps children with childhood apraxia of speech by giving them clear models of speech movements, combining sensory cues, and providing structured practice. These elements are essential for helping them develop the motor skills needed to speak more clearly and confidently.